Matty Graham here from Exponential Performance Coaching. Welcome back to another Whiteboard Wednesday. Today I have the question that we're looking at about should you be icing soft tissue injuries? Is this the best thing for the healing process, or are you doing yourself a disservice? Before we take a look at that, make sure you hit the subscribe button over here so you get instant notifications every time I upload a new training, nutrition or racing video. Let's take a look at it. I got this question, should you ice soft tissue injuries? And this has sort of come about because over the last 10 years or so, there's been this emerging field of research looking into icing tissue injuries, muscle and tendon injuries, and whether or not that actually helps improve the healing process. And over the last couple of years, this research has started to filter out into the public domain, and some people have picked it up and have been talking about it, and I think there's a lot of confused people out there. So should you actually ice soft tissue injuries? Let's take a look. So let's first of all take a look at what is inflammation, because inflammation is what it's all about. Inflammation is just the body's healing process. It's that swelling, that pain, that heat that you get around an injured joint, muscle, whatever it might be. So that swelling that you get is just the body sending fluid to the area that carries all of the hospital cells of the body. And these cells are going to clean up any bacteria in the area to stop infection. And they're also going to help repair the muscle cells or the tissue cells as well. The heat that is developed through increased blood flow, that's all about, again, killing bacteria or infection in the area. And then the pain, that's just because of the swelling is pushing on the nerves in the local area, causing that pain. And the pain's really important because the pain is there to say, this hurts, don't do it. So the body is protecting itself from further injury. If that pain is happening, then it's obviously hurting the body's not capable of doing it, so it wants you to stop. So that's the inflammation process, it's the body's healing process. Now let's look over at the current advice for soft tissue injuries. Most of you probably would have heard of RICE. It stands for rest, ice, compression, elevation, and to get a doctor's diagnosis. So RICE, as you can see, is just targeted at reducing inflammation. This in turn reduces pain. If you don't have that inflammatory response happening, that swelling's not going to be pushing on the local nerves, so you're not going to get the pain, with the idea of speeding up the healing process. But what it actually is doing is it's not actually speeding anything up, it's just bypassing the body's natural process of healing. And any anti-inflammatory drugs that you take, they're going to decrease the inflammation, decrease the pain as well. All of this is sort of speeding up the process so you can get back out on the field, you can get back into training, racing, competing, whatever it is. But when you think about what the inflammation process is all about, what we're doing is we're just stopping the body's ability to properly heal itself. So are we actually healing, or are we just blocking out the symptoms so that we feel better? A lot of modern medicine is all about stopping the symptoms so that you feel better. Same sort of thing goes with this RICE. We're all about reducing the swelling, reducing the pain, so that we can feel better, get on with what we need to do. But does it actually improve healing? A lot of research around this area has shown that icing injuries and decreasing this acute inflammation process actually decreases long-term healing. So the current advice that I would sort of recommend that is out there is let the body take its natural course over the acute phase when it comes to soft tissue injuries. Once you've taken care of any bleeding, you're not going to die. Say you've rolled your ankle, let your ankle swell, let it be sore so that you don't walk on it again, so it is able to get into this acute healing process. prolonged inflammation needs to be dealt with. If you have inflammation for weeks or for months, this hair starts to go stagnant. It's not productive for the healing process. So prolonged inflammation needs to be taken care of by a medical professional for sure, but acutely in the short term, inflammation's okay. Avoid ice and listen to your body. The ankle that you just rolled or the knee you just tweaked up is sore for a reason. You've hurt it, the body's sending that pain signal to say, don't walk on me, don't go for a run, don't go to the gym the next day. And there's potential implications day to day for your training. If you're wearing compression garments every day to make your muscles feel better the next day for training, you're just reducing the inflammation process as well. Ice baths after training, again, you're just reducing this inflammation process so that you'll feel better the next day, but not necessarily heal and get the adaptations that you're after. So should you ice soft tissue injuries? I would say no, let the body take its natural course of action acutely. If things aren't getting better by themselves, then you start to need to give them a move along in the long term, but acutely let the body do what it has been designed to do. So there you have it, soft tissue injuries and icing. If you've got any more questions on this, it's a huge subject. You could talk on it for days, so it's hard to cover in such a short video. But if you've got any more questions, let me know so I can give you the good information so you can train harder, but most importantly, train smarter and look after yourself. Make sure you hit the subscribe button over here so you get notifications every single time I upload a new video so you don't miss out on any of my training tips and information. If you want to know whether you should be training in the morning or in the evening, check out this video up the top here for that. And also if you want to check out a really good indoor cycling session that targets your technique and your fitness, click this video down the bottom here. Get out there, get into it, train hard, but most importantly, train smart.